Let me ask you something and be honest with yourself. Have you ever sat in the bathroom for 30, maybe even 60 minutes feeling like you need to go but nothing happens? You can feel it there, the pressure, the discomfort, but your body just will not respond. Then you give up, walk away frustrated, telling yourself you will try again later. But later comes, and the same thing happens again and again. If this sounds familiar, this is not just constipation, and it is not something a simple home remedy will fix. My name is Dr. Favor Adme, and this channel is dedicated to bringing you the latest evidence-based research on senior health in a way that is actually practical and easy to use. If you have not subscribed yet, I would encourage you to do that now so you never miss what we are covering today. I am going to explain what it really means when stool gets stuck in the rectum, why this is far more serious, especially after 60, and exactly what you should do step by step. We will be talking about real anatomy and real solutions. It may feel uncomfortable to discuss, but your health comes first. If this feels even slightly familiar to you, type yes in the comments right now. You are not alone, and typing that one word helps more people find this video who need it. Let me tell you about a patient I will call Solomon. Solomon was 72 years old, retired teacher. He had been dealing with what he called difficult bowels for over a year. He had tried every fiber supplement he could find. He was drinking more water. He had tried laxatives from the pharmacy multiple times. Some helped briefly. None solved the underlying problem. He came to me finally after his wife noticed he was spending 45 minutes in the bathroom every morning, coming out pale and visibly uncomfortable. When I examined Solomon, it took less than 5 minutes to identify what was actually wrong. He did not have ordinary constipation. He had a condition called fecal impaction, and the treatments he had been trying were not just ineffective for his actual condition. Some of them were making it worse. We will come back to Solomon because what we did to resolve his situation and the explanation I gave him about what had been happening in his body is the heart of everything in this video. Let me explain the anatomy first, because once you understand this, everything makes sense. The rectum is the final section of the large intestine before the anus. Its job is to temporarily store stool until the body is ready for a bowel movement. The rectal walls contain stretch receptors, nerve endings that detect when stool has arrived and signal the brain that it is time to go. The brain then coordinates a series of muscular contractions and relaxations that move the stool out. In a younger person with a well-functioning system, this process is smooth and efficient. Stool arrives, receptors signal, muscles respond, evacuation happens. After 60, several things change that interfere with this sequence. First, the muscles of the pelvic floor and the external anal sphincter lose strength and coordination with age. These muscles must relax precisely at the right moment during defecation. When they do not relax properly, or when they contract instead of relaxing, they create an obstruction even if the stool is physically there. This muscular dysfunction is called dysenergia, and research published in the American Journal of Gastroenterology estimates it affects between 25 and 50% of older adults with chronic defecation difficulty. Second, rectal sensation decreases with age. The stretch receptors become less sensitive. This means stool can accumulate in the rectum without producing the normal urge to go. The person does not feel the need to use the bathroom. The stool sits there. It continues to dry out because the colon absorbs water from it continuously. It hardens, and now you have a mass that cannot be expelled even when the person does try. Third, many medications commonly prescribed to seniors directly cause constipation and rectal impaction. Calcium channel blockers for blood pressure, iron supplements, opioid pain medications, certain antidepressants, and antihistamines all reduce bowel motility and harden stool. The World Journal of Gastroenterology published research confirming that polypharm pharmacy in older adults taking 5 or more medications simultaneously was one of the strongest predictors of fecal impaction in this population. When stool becomes hardened and impacted in the rectum, ordinary laxatives that work by increasing bowel motility higher up in the intestine cannot move it. The mass is already past the point where motility stimulants are effective. More fiber can make the problem worse by adding bulk above an already blocked outlet. This is why so many seniors feel their efforts are not working. They are treating the wrong problem with the wrong tools. The condition is called fecal impaction. Here are the symptoms that distinguish it from ordinary constipation. The first sign is the sensation of rectal fullness that does not resolve. You feel like you need to go. You sit, nothing comes. This goes on for days. The second sign is paradoxical diarrhea. This is the one that most surprises people. Liquid stool from higher up in the colon can seep around the hardened impacted mass and appear at the anus as loose or watery stool. People with fecal impaction sometimes mistakenly believe they have diarrhea when the opposite is true. They take anti-diarrheal medication, which makes the impaction worse. The third sign is pain and bloating in the lower abdomen, sometimes cramping, sometimes a constant low-level pressure. The fourth sign is a feeling of incomplete evacuation. After a bowel movement, however small, the sensation of fullness remains. The fifth sign, which is particularly important for older adults, is confusion and cognitive changes. Research published in Age and Aging found that fecal impaction in older adults can cause or worsen delirium, disorientation, and cognitive decline because of the toxic absorption from accumulated stool and the pain-related autonomic stress response. Many hospital admissions of confused elderly patients are precipitated by unrecognized fecal impaction. If you have made it this far, you are clearly invested. You want to see what happens next, but most viewers enjoy the content and scroll away without subscribing. If this one really means something to you, tap subscribe. It takes a second. If not, you will probably forget this channel exists and miss a lot of great educational content ahead. Over the years in my clinic, I have seen one simple truth. Real progress does not come from doing anything extreme. It comes from doing the right small things consistently every single day. That is exactly why I created the 30-day blood pressure reset for seniors. It is a simple step-by-step plan designed to help support healthy blood pressure. Through gentle daily routines, light exercises, and clear guidance, you can easily follow at home. Some of my patients, and even people who have already gotten the guide, have followed this exact structure and started seeing real noticeable improvements. You will actually see some of their feedback on your screen because I want you to hear it directly from them. Many of them have shared that they feel more in control of their daily habits, more confident about their blood pressure readings, and more at peace knowing they are finally doing the right things for their health. For many of them, it was not about drastic changes. It was about having a clear, simple plan they could actually stick to. And that is what made the difference. I am not opening this to everyone. I am only allowing 30 people to go through it right now because I want to follow up closely. If you feel like your current routine is not giving you the clarity or results you need, click the link in the description or scan the QR code on your screen to get your copy before all the spots are filled. And because you are part of this community, I have made it easier for you with a 70% discount. After you get your copy, drop your email and I will personally follow up with you. Now let us talk about what to actually do. What to do. Step-by-step treatment and prevention. Step 1 is to recognize that self-treatment with over-the-counter stimulant laxatives is not appropriate for established fecal impaction. Products like Biscodal or Senna work by stimulating contractions in the colon above the rectum. If the outlet is blocked by hardened impacted stool, these contractions cannot move it. They only create painful cramping against a blocked outlet. If you have been experiencing the symptoms described above for more than 3 days, you need medical evaluation, not more pharmacy products. Step 2 is rectal disimpaction. This is the medical term for the procedure that physically removes or breaks down the hardened stool mass. For a mild impaction, this may be achieved with a glycerin suppository or a sodium phosphate enema, which introduce moisture directly into the rectum to soften the mass. For a more established impaction, manual disinfection by a doctor or nurse may be required. This is a simple clinical procedure, and it is not as uncomfortable as it sounds. Research from the nursing standard confirms it is one of the most effective first-line treatments for established rectal impaction and is routinely performed in outpatient settings. Step 3 is addressing the underlying cause. This is the step that most people skip, which is why rectal impaction recurs. Review your medications with your doctor and identify which ones are contributing to constipation. discuss whether alternatives exist. If pelvic floor dyssyneria is the underlying cause, physiotherapy specifically targeting pelvic floor coordination called BOF feedback therapy is evidence-based and highly effective. Research published in Diseases of the Colon and Rectum found that BOF feedback therapy resolved defecation dysuria in over 70% of patients treated. Step 4 is long-term prevention through 3 specific daily habits. Drink 1.5 to 2 L of water daily, because stool dries and hardens when the colon is extracting water from an underhydrated system. Do not ignore the urge to defecate when it arises, because chronic suppression of the urge desensitizes the rectal stretch receptors further over time. And use a small stool under your feet when on the toilet to raise your knees above hip level. This positions the rectum in a more natural squatting angle that reduces the muscular effort required for evacuation. Research published in the Journal of Clinical Gastroenterology found this simple foot tool technique significantly reduced straining and evacuation time in adults with defecation difficulty. I promised I would come back to Solomon. After the initial Impaction at my clinic, we reviewed his medications and found that 2 of the 5 he was taking had constipation as a known side effect. We worked with his GP to switch one of them to an alternative. We referred him to a pelvic floor physiotherapist for BOF feedback, and we gave him the 4 daily habit protocol above. 6 weeks later, his wife called the clinic to say he was having a normal bowel movement every day for the first time in over a year. She said he seemed like a different person, less irritable, more comfortable, more himself. He came in at the 8-week mark and said something I think about regularly. I spent a year being told to eat more bran and drink more water. Nobody told me the outlet was the actual problem. That is the gap this video is closing. Let me close with the key points clearly stated. Stool stuck in the rectum is called fecal impaction. It is not ordinary constipation. It is caused by a combination of age-related changes in rectal muscle coordination, reduced rectal sensation, medication effects, and chronic suppression of the defecation urge. The symptoms are rectal fullness that does not resolve, paradoxical diarrhea, lower abdominal pain, incomplete evacuation, and in older adults, confusion and cognitive changes. The treatment is medical evaluation, rectal disimpaction if needed, identification of contributing medications, pelvic floor physiotherapy for dyssynergia, and 4 specific daily habits. Adequate hydration, responding to the urge immediately, a footstool under the feet on the toilet, and never using stimulant laxatives for an established impaction. Have you experienced any of these symptoms? Tell me in the comments. And if someone you know has been quietly suffering with this and assuming it is just normal aging, share this video with them today. Before you go, think about this for a moment. Most people keep waiting for the perfect time to take their health seriously, but that moment usually never comes. That is exactly why I put together the 30-day blood pressure reset for seniors. It is designed to help you follow a simple structured daily routine that supports healthy blood pressure without confusion or stress. Inside you will find gentle exercises, practical daily habits, and a clear step-by-step plan you can actually stick to. Some of my patients and even people who have already gotten the guide have followed this exact structure and started seeing real noticeable improvements. You will see some of their feedback on your screen because I want you to hear it directly from them. Many of them have shared that they feel more in control of their habits, more confident about their readings, and more at peace knowing they are finally doing the right things for their health. For many of them, it was not about drastic changes. It was about having a clear and simple plan they could follow consistently. And that is what made the difference. Now I am keeping this very limited. Only 30 spots are available and 5 are already gone, which means just 25 spots are left. Once those spots are filled, I will close it. If you feel ready to start something simple and consistent, click the link in the description or scan the QR code on your screen to secure your spot now. And because you are part of this community, I have made it easier for you with a 70% discount. After you get your copy, drop your email and I will personally follow up with you, checking in and helping you stay consistent with the plan. Disclaimer: Everything shared in this video is general medical and educational information based on current published research in gastroenterology and geriatric medicine. It is not personal medical advice for your individual situation. If you are experiencing symptoms of fecal impaction, please seek medical evaluation promptly. Do not attempt self-treatment for an established impaction. Your doctor or nurse can assess your situation and provide appropriate clinical treatment safely.